What constitutes a healthy neck curve, and why would that even be important? Well, let's talk about three aspects to this. We've got bone, discs, and nerves, in this case the spinal cord. And so with a nice C-shaped curve, which should be between 35 and 42 degrees, that's ideal, with your head back over your shoulders, so in this case, head back over the shoulders, nice curve. What that does is it helps to distribute force. When there's a straight spine, or a spine that's tilted in the wrong direction, there's increased force on that spine. So here's an example. For every 25 millimeters, every inch of head forward posture, it adds 10 pounds of weight to your skull. That weight is going into the discs, into the bones, and also putting stress on the spinal cord. So with a nice curve, it's why we're trying to establish the ideal of as best we can, the best curve that we possibly can with our patients, whether it's their neck or other parts of their spine. The balance of weight on their spine is critical. So we want that to happen so that the discs are nice and healthy. We don't have pressure on the bone, because when we have pressure on discs, they lose their water content. We call this degenerative disc disease. A lot of people think of that as being an aging thing. And yes, we do see more of it with aging, but we see it mainly because of the loss of appropriate curve in the spine. Also, we're seeing all these white areas around the bone. That's extra bone growth. When a bone is under stress, its natural response is to create more bone to meet the demands of that stress. Just like a muscle grows when you work it out, if bone is under stress, it's going to create more bone. And we call these osteophytes, or bone spurs. And that's part of what's called osteoarthritis, or degenerative arthritis. Another thing that people are often told is because of aging. It's common with people who are older. But you know what? It's not normal. So these are things that can be prevented. We can make sure that this is not your scenario. The next thing is what happens with the spinal cord, and this is most important, because your life-giving messages, your function-giving messages have to travel back and forth through that spinal cord, brain to body, body to brain, constant dialogue happening. That is a must for you to live the life that you were designed to live for. And so with this stretch in the cord, something's called tethered cord syndrome, it's damaging to that cord. There's a one-to-one relationship with head forward posture and decreased nerve flow through that cord, as peer-reviewed research is showing. So we want to bring this scenario into play, and that's what we do with our structural corrective care. We're doing chiropractic adjustments in such a way, and giving the appropriate homework to establish a curve that looks like this. So discs are healthy, bones are healthy, nerve messages are healthy, so you are healthy.